Hi, good evening to all of you. So, we are here on this World Heart Day. Occasion today is a World Heart Day, and we assemble here to discuss the resilience and strength of our heart. The fact is, our heart actually beats almost 2.5 to 3 billion times in our average lifespan without skipping a beat. So, that is important. Heart means life, running heart means life. So while this is the fact, there is also a very big growing concern in our society. The heart attacks happening in the young population. It is rampantly increasing, and we actually hear a news day in and day out in our society that someone young individual has got a heart attack and is debilitated because of that. So it is a big concern. And uh, if we go by figures, I tell you almost 25% of the heart attacks in India, they happen in the younger population. Well, once I say younger population, less than 40 years of age. So it's a big number. And there is one more fact attached to it. Now, out of these heart attacks, which happen in less than 40 years of age, 20 to 25% have no risk factors. So we don't even know that who is the candidate, who's the person who is going to have a heart attack. So that means, is everybody vulnerable in the younger population? I think this is where we are here to introspect and discuss this today's program. So we are not going to talk about a lot of statistics. Statistics on the one side, we are here to talk about the strength and survival post heart attack. Now that is totally a different domain. It takes a lot of great courage to come out of such an episode, not only for the person who is affected, but for the full family. And that is where we assemble here to discuss the today's World Heart Day discussion. I'm absolutely honored to welcome such a story, such a gentleman who did exactly that, making, coming out of a personal crisis and staying strong and then getting back into the life. So please join me in welcoming one of the Bollywood's most talented and very versatile actor, Mr. Shreyas Talpade, who's here with us to share his journey and give us his inputs regarding the heart health. Welcome, Shreyas.
Thank you so much, sir. Thank you for the kind words.
Yeah, we
And
are absolutely
absolute,
delighted. Yeah, please go on.
it's an absolute honor being here, having a conversation with you of all the people, one of the legends in the industry. So thank you so much for having me today on the occasion of World Heart Day.
Yeah. So idea, Shreyas, today is it's a World Heart Day, and as you know, so we want first of all your experience. We all know through the media reports that you also had some kind of a heart event few years back. So what was that event, and what was your feeling at that point of time? What happened, and how traumatic it was for you, family, everybody around you? So please share your insights for that.
So, Dr. Kapoor, actually, I personally, we've had a family history of heart ailments, like my father, my uncles, my aunts, and things like that. So most of us brothers and cousins, and all of us try to be as careful as possible as far as heart is concerned. So we take appropriate precautions in our diet, on our exercises, and our sleep patterns, and things like that. And that's exactly what I was doing. And so, of the four parameters, whether diabetes or hypertension or smoking or drinking, I was not really qualifying in any of those. So no drinker, no smoker, no hypertension, no diabetes, nothing. And I felt that I was okay. Personally, somewhere, I keep talking about it. I feel that it is pretty much post the vaccination of COVID is what things started changing for me. I started feeling a little fatigue through the day. As soon as I would wake up, even after a long night's sleep of, let's say, 8 to 9 hours, whenever I would wake up, I would feel tired. I would feel fatigued, and that was a concern area. Even in my work, Usually if I would get tired after working for 8 hours, I started getting tired working for 4 hours. Workouts, if I would get tired after 1 hour of workout, I started getting tired in 15-20 minutes. So all this stamina, flexibility started going for a toss, and I was a little concerned. So I went for my checkups. I did my ECGs and 2D echoes and things like that. But the reports were pretty normal, and the doctor said there's nothing really to worry about. Um, One thing I missed, though, that I should have gone for a stress test as well, which I didn't. And probably that would have been one more better marker for me to, diagnose my problem earlier on. But I felt I was okay until one day when my blood pressure really shot up, and I had this incident, and it was a very, very unfortunate and very shocking incident for all of us. But thankfully, all thanks to God Almighty and my wife for saving me at the right time, and obviously the doctors who put in all their effort, all their might to make sure that I see the light of day.
No, that is a story which I think, thanks for sharing that. But tell me one thing. You mentioned that you have a family history. So in your family history, both parents have a history of heart disease?
Not really. My father's side has had that history. Like my father, my uncles, my aunts, my grandfather. Um, so there have been cases where they really had a massive heart attack um, when they were aged 55, 58, 60, and things like that. Mostly my uncles. Even my father had a heart attack when he was around 58 for the first time. Luckily, we were able to save him at that point in time. And then he lived for another 20 years after that.
Okay, so from the medical point of view, I can narrate here that if the family history is strong on either parent side or both parent side, the risk factor profiling of the next generation is much higher. So
Yeah.
that is where we do a risk scoring of any individual based on the risk factor profiling, and this is a very strong factor if it is running in genes. So if it is running
Mm.
in genes, we do advise to have more advanced testings in terms of, obviously we are testing sugars, cholesterols, stress test, as you mentioned. Stress test has the ability to pick up the disease before it is hitting us. It is still concealed
Yeah.
inside, but stress test can expose that. Another test which, if
My
the
cholesterol, my cholesterol actually was on a higher side, and I had started a very, very basic medication for that, and it was getting down, but not low enough to not make the incident happen. So cholesterol, yes, was probably one of the major factors which was on the higher
right.
side.
Right. So that's what I was actually talking, that a more advanced form of a test can actually tell us what kind of plaque formation or what kind of blockage is already creeping up in our coronary tree, which can lead to such events. So that, for that, there is one test. The threshold for CT coronary scan also should be lower in individuals who have a bigger risk factors for heart disease. So that is just on the talking front. So you also mentioned post COVID. I think that's a discussion which we want to do for our audience, or for all the listeners. Yeah, yes, there has been some concerns that post COVID vaccination. You had COVID also, clinical COVID.
Yes.
Okay, so after that, the vaccination was given. So yes, so post COVID or post COVID vaccination, there has been concerns that heart disease has gone up after that. Somewhere there were concerns, and it was in the literature that even the vaccine companies, they accepted that the inflammation can go into the heart muscle and lead on to certain events, and also the blood clotting increased. So heart disease or heart attacks went up for some point of time, although now the effects are not there. I mean, the vaccination effects have weaned off, so it is not a problem now. But that is always been in discussion after post COVID. So one more thing, Shreyas, which is very intriguing to us, your field. I mean, normally you must be going through tight schedules. You must be up at nights. Working hours must be a very big, exhausting. Even so, how's your sleep patterns? We just wish to know. We are just kind of introspecting and ruminating that uh, whether other lifestyle measures were also a reason behind this.
Could be. I wouldn't deny that because considering our profession and we have odd working hours. So sometimes when we start working, we go on for 12 hours, 14 hours, 16 hours at a stretch. We pack up late in the night, we travel, and there are multiple shifts that we keep doing, maybe double shift, triple shift, and things like that. So yes, all those things also, I'm sure, must be affecting the body. Um, and at that point in time, yes, I was working out, and I was working also pretty hard. There were multiple projects that were happening, and I was shooting for. Having said that, I mean, that physical stress apart, mentally, actually, I was in a very happy space. I was not really worried about anything. I was not mentally stressed about anything. The physical stress definitely was there, um, and that probably also could be one of the major factors uh, leading to this. Post the incident, this that I've done to my work pattern or my routine, where I have my dinner really early. I try to finish off my dinner by 7:30. Try and sleep at least 7 to 8 hours. I sleep early. Of course, there's a certain diet that I tend to follow. So all these things have happened after that. It was a big wake up call for all of us, and things have changed after that. Earlier, yes, there were odd shooting hours and schedules and routines, which probably could also be responsible.
Okay, yeah, thanks for sharing this also. Now, just to put further highlight on this, that we did a study here at our hospital where we found that sleep deprivation is a new risk factor for heart attacks. The today's younger population, they are much engrossed in work, or in the social media, and at nights they are still not sleeping because they are engaged with the phone, or watching the screen. So that also leads to some kind of sleep deprivation, and it is documented that if one sleeps lesser than 7 hours per 24 hours, so that also somewhere increases the vulnerability for heart episodes or heart attacks. So this is one I just wanted to add on to this. Shreyas, if you are comfortable, there is some request coming that we should also speak in Hindi, because there are many people who are joining, and they want to raise the questions also in between. सो श्रेयस, मैं
जी
इसी
जी जी
की कंटिन्यूएशन में पूछूंगा आपसे. आपने बोला भी जैसे पहले, इस एपिसोड से पहले एक आपका लाइफस्टाइल था जो कि जैसा आपने बताया, रीजनेबली इट वाज प्रीटी गुड, आई कैन से दैट. बट उसके बाद क्या स्पेशल चेंजेस आपने किए, या अभी आप बहुत विजिलेंट हैं, जो और हार्ट डिजीज को और हार्ट को स्ट्रॉन्ग करने के लिए आप लाइफस्टाइल में चेंजेस कर रहे हो?
सबसे पहली बात, जो जैसे आपने कहा कि स्लीप, नींद, जो रात की नींद है वो आपकी पूरी पूरी कम से कम 7 से 8 घंटे की नींद होनी चाहिए। ये सबसे बड़ा चेंज किया हुआ है मैंने। उसके बाद जल्दी सोना। सो यूजुअली हम पहले मैं 12 साढ़े 12 1 बज जाता था सोते सोते। अब मैं कोशिश करता हूँ कि 10 साढ़े 10 तक मैं सो जाऊँ, और सुबह अप्रॉक्सीमेटली साढ़े 5 6 के आसपास मैं उठ जाता हूँ। सो जल्दी सोना, जल्दी खाना। अगर 10 बजे तक सो जाना है तो मैं 7 साढ़े 7 तक खाना अपना ख़त्म करता हूँ। उसके बाद आराम से 3 4 घंटे मिल जाते हैं खाना प्रॉपर्ली डाइजेस्ट होने के लिए। डाइट वैसे पहले से ही काफ़ी कंट्रोल्ड था। जैसे मैं ऑयली ज़्यादा खाता नहीं था, फ्राइड नहीं खाता था, बटर वगैरह ज़्यादा नहीं खाता था, तो मैं वो अभी भी चल रहा है। इनफैक्ट उसको थोड़ा सा और स्ट्रिक्ट कर दिया है डाइट को। रेड मीट मेरा बंद है, शेल फिश बंद है। चिकन का लेता हूँ, प्रोटीन्स लेता हूँ, बट रेड मीट वगैरह बंद है। एंड सबसे इम्पॉर्टेंट चीज़ जो है वो है एक्सरसाइज। सो हफ्ते में कम से कम 4 से 5 दिन वर्कआउट करने की कोशिश करता हूँ। और जब मैं वर्कआउट माने ज़्यादातर कार्डियो रहता है, बट थोड़ा सा स्ट्रेंथ ट्रेनिंग, थोड़ा सा मसल ट्रेनिंग भी करता हूँ, क्योंकि सिर्फ कार्डियो भी अच्छा नहीं है, थोड़ा सा मसल भी आपका इंटैक्ट और थोड़ा स्ट्रांग रहना ज़रूरी है। जैसे व्हाट आई हैव रियलाइज्ड इज़ कि आप जैसे जैसे थोड़े और एज आपकी बनते जाती है, उस वक्त आपका मसल स्ट्रांग होना ज़्यादा ज़रूरी है। तो ये कुछ चेंजेस है जो मुझे लगता है बड़े बेसिक से है। एंड मैं यही रिक्वेस्ट करूँगा सबसे कि कुछ होने का इंतज़ार मत कीजिए। अगर अभी आप ये चेंजेस कर सकते हैं लाइफस्टाइल में, तो प्लीज़ अभी से शुरू कर दीजिए। आपको खुद वो फ़र्क महसूस होगा और आपको खुद पता चलेगा कि कितना आप फ्रेश फील करते हो, कितना आप ज़्यादा काम कर सकते हो उसके वजह से।
बिल्कुल. So these are very important tips, and I think everybody should follow it. And one more thing, Shreyas, I want to ask. तो अभी आप रेगुलर 6 मंथली चेक्स करते हैं शुगर एंड कोलेस्ट्रॉल्स?
जी 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 बिल्कुल। मैं इनफैक्ट ब्लड प्रेशर तो मैं रोज मॉनिटर करता हूँ। सवेरे एक बार करता हूँ, एक बार आफ्टरनून या इवनिंग में जब शूट्स हो तो मैं मॉनिटर करता रहता हूँ। और उसके अलावा एवरी 3 to 6 months एक ब्लड वर्कअप करते हैं, ताकि कोलेस्ट्रॉल वगैरह का पता चले कि क्या चेंजेस हो रहे हैं। एंड एट द सेम टाइम बाकी भी कुछ अगर चीज़ें फाइंड आउट करनी हो तो मैं वो करता रहता हूँ। बट एवरी 6 मंथ्स, एवरी मंथ ऑफ कोर्स डॉक्टर की विजिट रहती है। एक्चुअली क्या होता है, हम ना काफ़ी चीज़ें ग्रांटेड ले लेते हैं और हमें ऐसे लगने लगता है कि अरे ठीक है ना यार, अब ठीक है, अगले महीने चले जाएंगे, अगले हफ्ते चले जाएंगे। बट चीज़ें बदलने में सिर्फ 1 सेकेंड काफ़ी होता है। जो मैंने रियलाइज़ किया दैट 1 सेकेंड चेंज्ड एवरीथिंग फॉर मी। सो आई थिंक बहुत ज़रूरी है कि हम अपने आप को, अपने बॉडी को, अपने फैमिली को थोड़ा सीरियसली लें। और आज तो ऐसा टाइम है कि छोटी सी छोटी चीज़ भी आपको बिल्कुल ग्रांटेड नहीं लेनी चाहिए। अगर आपको लगता है कि कोई थोड़ा प्रॉब्लम है, तो या तो दवाई लीजिए या इमीडिएटली डॉक्टर के पास जाके चेकअप करवा लीजिए। सो आई ट्राई टू मेंटेन इट एज मच एज पॉसिबल। बाकी तो
No, I think this is the
भगवान
best
जाने।
statement which you have given. We should not take ourselves for granted, our health for granted. This is the biggest mistake which everybody is doing. हम सब लोग सब कुछ करेंगे, मतलब हम सब लोग एंटरटेनमेंट के लिए मूवी देखेंगे, जाएंगे, कुछ भी करेंगे, पार्टी करेंगे, बट जहाँ हेल्थ की बात आती है, एंड दिस इनर्शिया और दिस प्रोक्रेस्टिनेशन, हाँ कल कर लेंगे, एक हफ्ता बाद कर लेंगे, 10 दिन बाद कर लेंगे, ये चलते चलते वो बढ़ता चला जाता है। And then suddenly, once
जी।
things go down and you are in trouble, that time we start waking up. This is the psyche, this is the problem
या
in our society, which we are trying to address. And I think there's no better person than you who's telling everybody to actually fall in line, and किसी प्रॉब्लम के आने से पहले अपने आप को ठीक करना ही सबसे जरूरी है अपनी हार्ट हेल्थ को अच्छा रखने के लिए. So one more
बिल्कुल
thing, Shreyas, the
बिल्कुल
family
मत।
support and friend support. I think that is also something which is extremely important. Once you had this event and is coming out of this, and there should be someone who should be constantly telling you, no, this is not good for you. You refrain from this. You refrain from, having a diet which is high in cholesterol or rich in oil. There should be constant bombardment which is required with the due course.
एक्चुअली मुझे लगता है डॉक्टर साहब कि क्यों, मतलब किसी और को बताने की ज़रूरत पड़नी चाहिए। हम खुद समझदार लोग हैं, हम खुद बाकी सारी चीज़ें तो हमें समझ में आ जाती है। किसी को ज्ञान देना हो तो हमें समझ में आ जाता है। किसी को इंस्टा पे कुछ और बताना हो कि अरे आपने ये ठीक से नहीं खेला, वो हमें समझ में आ जाता है। फिर इसके लिए हम किसी और पे डिपेंडेंट क्यों रहे? व्हेन वी अंडरस्टैंड सो मेनी थिंग्स, देन वी शुड अंडरस्टैंड द फैक्ट दैट आवर बॉडी, our life is our own responsibility, and we better be responsible about it, because there's a responsibility not only towards ourselves but also towards our family, जो हमारे लिए इतना कुछ करते रहते हैं, इतना कुछ sacrifices करते रहते हैं, इतना कुछ डिपेंडेंट रहते हैं कई कई बार। तो तो ये हमारी ज़िम्मेदारी है कि हम और उन्हें, मुझे लगता है कि आपको अगर कभी डिस्कम्फ़र्ट हो तो हम सोचते हैं कि यार फैमिली को नहीं बताते हैं, अभी उनको क्यों परेशान करें? तो उस वक़्त मुझे लगता है कि उन्हें परेशान कीजिए, उन्हें बताइए आपको क्या हो रहा है। ओके, कभी-कभी ऐसा हो सकता है कि वो आपको एक बेटर सजेशन दे। जैसे मैंने मेरी वाइफ़ को उस शाम को बताया कि नहीं, आई एम नॉट कीपिंग वेल, you know, I'm not comfortable, and she immediately took a call. She said nothing doing, हम अभी के अभी हॉस्पिटल जाएंगे, डॉक्टर को दिखाएंगे, अगर कुछ नहीं है तो बहुत अच्छी बात है, लेकिन अगर कुछ है तो ये अभी के अभी चेक होना ज़रूरी है. So without wasting a single moment, she just put me in the car and she took me there. So it's important कि अगर आपको तकलीफ हो रही है तो आप आपके फैमिली मेंबर में किसी को बताइए. एंड अगर वैसा कोई आपको सजेस्ट करने वाला नहीं है वैक्सीन है कि आप सीधे डॉक्टर के पास चले जाइए. इट इज़ रियली नॉट वर्थ कि आप खुद ही मेडिकेशन कर लो, खुद ही सोच लो कि अरे कुछ नहीं होगा, देख लेते और 1 घंटा रुक के देख लेते. वो रुकना आपके लिए हानिकारक हो सकता है. इज़ वॉट आई हैव लर्नड फ्रॉम माई एक्सपीरियंस, एंड आई फील इट्स इम्पॉर्टेंट दैट वी not take ourselves lightly.
No, this is extremely valuable. That's what even I was trying to say, that if you are the solo deciding factor, you have to decide everything. There may be more inertia, but other person's brain coming into the decision making may make it simpler for you. और सिंपल यही भी, आप
Correct.
चलो एक प्रॉब्लम आया है, उसको कोशिश तो करें क्या है, उसका डायग्नोस तो बनाएं. एंड इफ वी कीप डिलेइंग,
जी जी.
हमारे पास ऐसे पेशेंट्स आते हैं श्रेयस, जो बोलते हैं हाँ 1 महीना पहले चेस्ट पेन हुआ था, बट मैंने सोचा गैस्ट्राइटिस था, एसिडिटी था, हमने कहीं दिखाया नहीं. अब नाउ आफ्टर 1 मंथ इफ आई एम डूइंग अ ईसीजी ऑन दैट पर्सन, and I know that patient already had a big heart attack at that point of time, which could have been
Hmm.
a different scenario if he would have presented at that point of time. So anyway, I
जी.
think this is very important. Discuss issues with family and friends, they are for you. And
Yeah.
I strongly believe the most important person in your life is, first of all, you. So you should be taking care of yourself. Your heart is extremely, extremely precious. अगर आपको कुछ
Yeah.
ऐसे सस्पिशियस सिम्टम्स हैं, आप बात करें फैमिली से, आप उसके लिए आगे बढ़ें, उसको दबाएं नहीं उस सिम्टम को. एंड दिस इज ऑल्सो more so true in our society with females. There is a myth, Shreyas, I tell you, that females are immune to heart disease. This is a myth. This is not a fact. So yes,
Hmm.
there may be slight discrepancies as regards the heart attack incidence is concerned between males and females, but in today's era where stress is big and most of the females are working now, initially they were homebound, so they are
Yeah.
also equally vulnerable, almost equal to males. So this myth is no longer existing. So if even if they have some symptoms, they should not try to suppress it or conceal it. They should come out with that. So this was great
बिल्कुल.
talking. Any other tip, any non-negotiable advice which you want to give to our younger population so that they stay fit and healthy from heart?
मैं बस यही दोहराऊंगा कि अपने अपने डाइट का ख्याल रखिए, अपनी हेल्थ मॉनिटर कीजिए. जैसे मैं आज बिना शर्म के मैं अपना ब्लड प्रेशर का मशीन अपने साथ बैग में कैरी करता हूँ, वेदर आई एम एट द एयरपोर्ट और वेदर आई एम ट्रैवलिंग एनीवेयर इन द फ्लाइट. जहाँ मुझे ऐसा लगता है कि मुझे चेक करना है, मैं मशीन निकालता हूँ और चेक कर लेता हूँ. लोगों को क्या लगना है लगते रहे. फाइनली जब कुछ चीज़ होती है आपके साथ, तो वो सिर्फ आपको आपको अफेक्ट करती है, आपके फैमिली को अफेक्ट करती है. तो बाकियों को क्या लगता है इससे मैं ज़्यादा उस पर ध्यान नहीं देता. आई ट्राई एंड मेक श्योर दैट आई एम ओके एट दैट पॉइंट इन टाइम, विच इज़ द मोस्ट इम्पॉर्टेंट थिंग. सो प्लीज़ लिसन टू योर बॉडी. मैं यही कहूँगा कि कीप लिसनिंग टू योर बॉडी, बिकॉज आप खुद जानते हैं कि आप कल जो चीज़ कर रहे थे वो आज आप बेटर कर रहे हैं या आज प्रॉब्लम है. अगर प्रॉब्लम है, then the problem needs to be checked immediately with a proper physician and a doctor.
So great. This was all very good statements, and these are the things which are looking very simple and trivial, but they matter a lot. They become very big if we do not take
जी.
care of that. Shreyas, on the other side, so you have enthralled our audiences with your beautiful acting and movies. Golmaal, or that cricket movie was also very good, where you were a protagonist, and Iqbal was there, right? So any
Yeah.
so where we can see you more with the new upcoming movies?
So there's one film which we announced today. It's called Single Salma, and it is releasing in October. It has me, Huma Qureshi, Sunny Singh, Kawaljeet sir, and a lot of other fantastic actors. But that is releasing next month, and then it'll also come on Netflix. Post that, of course, Golmaal का जो नया फिफ्थ पार्ट है उसकी तैयारी शुरू हो गई है, तो जल्द से जल्द हम
I think I don't know audience knows it or not, but I think Pushpa 2 was dubbed by Shreyas. It's your voice. Is it right? Great. So all the best to you. I mean, we wish you a best of the health and a great future ahead, Shreyas. Thanks for connecting with us. It was wonderful talking to you. And coming from your mouth, people would actually connect with this, that what happens actually once anybody at the younger age gets a heart problem or a heart attack. Very simple things, which I think you mentioned it very discreetly, very clearly. So if we continue to take care of those things in a meticulous manner, I think we can keep our heart healthy. And that is the message. That is the message on this World Heart Day. Please stay healthy, have your good heart health, and that is where you can actually enjoy all the essence of life. Thank you,
yeah.
Shreyas.
Thank you, sir. Thank you. Lovely talking to you, sir. Thank you.
Thank you. Wonderful. Wonderful. Thank you.